stay at home. This short, sharp stop was implemented to allow our essential services, such as contact tracing, to catch up with the volume of cases brought out by this outbreak of the B.1.1.7 variant in Bermuda. As I speak to you today, 17 people have died, a number of persons are in the intensive care unit, and over 40 people are in hospital directly as a result of COVID-19. In the midst of the clamor for exemptions and the criticism of this renewed period of restriction of movements around the island, I urge everyone to pause and reflect on the incredible human costs that we are seeing and recognize that it is all in place to design to prevent more families from enduring the pain of loss and anguish of serious illness of loved ones. I am joined today by the Minister of Health, the Honorable Kim Wilson, and Dr. Wesley Miller, Chief of Staff of the Bermuda Hospitals Board, who is here to also answer questions from the media. I now invite the Minister of Health to give an update from her ministry. Minister?
Good evening. There were 1,385 test results received by the Ministry of Health since the last update, and 37 were positive for the coronavirus. This gives a test positivity rate of 2.7%. 2 of the new cases are classified as imported with details as follows. 1 resident who arrived on British Airways flight BA159 from London on the 6th of April, 2021 and tested positive on their day 8 test, and 1 resident who arrived on American Airlines flight AA308 from Miami on the 31st of March, 2021 and tested positive on their day 14 test. 12 of the new cases are classified as local transmission with known contact as associated with known cases. The additional 23 new cases are classified as under investigation. These cases are among residents with no currently identifiable link to other known cases or history of travel within the last 14 days. There were 55 recoveries and 0 deaths. Bermuda has 2,060 total confirmed positive cases, and their status is as follows. There are 848 active cases, of which 808 are under public health monitoring, and 40 are in hospital with 8 in intensive care. A total of 1,195 have recovered, and the total deceased is 17. As investigations proceed, transmission categories may change. Of the over 200,000 test results reported, the mean age of all persons tested is 43 years, with the median being 42 years, and the ages range from less than 1 year to greater than 100 years. The 7-day average of our real-time reproduction number is just below 1, namely 0.99. Bermuda's country WHO current status remains at community transmission. Yesterday, I announced that Bermuda had reached more than 2,000 positive cases. Today, that number is 2,060. 2,060 people, 2,060 families who are living or have lived with health concerns about themselves and their loved ones, asking questions like, will the symptoms be mild or will the symptoms be severe? 2,060 worried people about the impact their diagnosis will have on others, their extended family, their friends, their colleagues, or their elderly relatives. We must continue to look beyond the numbers and see the people and understand their concerns. We must also remember and keep in prayers the families who have lost a loved one due to the coronavirus. Over the months and weeks, people have shared their stories with me, told me how they have managed, how family and friends have come to their aid, the loneliness of being in shelter in place, and this week during the stay-at-home regulations. One colleague shared with me how her brother, who lives alone, had to be alone while he was sick and no one could visit. Family and friends doing what they could from the outside of his house. I've had seniors share with me their fears about seeing their children and grandchildren, asking, suppose they had the virus when they visited, but they didn't know. It's these stories and others that speak to why we have the stay-at-home regulations this week. This is why we must not mix families at this time. The number of positive cases may drop. We have to provide the healthcare system with relief, and that includes our one and only hospital. I must report again today that there are 40 patients in the hospital who need medical support to battle this disease. Since yesterday's update, and at that time, of our reporting, there have been 3 new admissions into hospital. 5 people have been discharged, 8 are in ICU, and 1 patient is intubated. We also send our prayers and thoughts to each of those members and their families. Against this backdrop, some in our community are choosing not to get vaccinated. If you have any questions, visit the coronavirus.gov.bm or other reputable sites. If you want firsthand knowledge about the vaccine, call your doctor. Ask all of the questions that you have about the vaccine and whether or not you should get it. There's no single decision process. People decide to get the vaccine for a number of reasons, some because they want to protect themselves and others. Some make the decision because they want to travel when it is safe to do so. Others do it because it is the right thing to do for our community and they want to get back to a new level of normal. If you haven't already done so, register today to get vaccinated. Having the vaccine does not necessarily stop you from getting the disease, but it does lessen the severity of the disease if you should get it. And to this end, I repeat my appeal to doctors in Bermuda to give us some of your time. If every doctor in Bermuda takes 1 or 2 shifts on a weekday evening or during the day on Saturdays or Sundays, we will succeed in reaching our goal, to have almost complete immunity by the 28th of May, Bermuda Day. If you can help, please send an email to Dr. Brett Lafferwitz at blefkowitz@gov.bm. And thank you to all those medical professionals who have already come forward to say that they will assist us. As revised restrictions are put in place, I must restate that this UK variant of the coronavirus is extremely contagious and the symptoms can be very difficult to pinpoint. Symptoms include cough, tiredness, headache, muscle ache, and sore throat. If you experience any of these symptoms, please contact your doctor and make an appointment to get tested. Likewise, if you have been in contact with someone who has had these symptoms, immediately make an appointment for yourself to get tested. As a reminder, each of us has a role to play to stopping the spread of coronavirus. Follow public health guidelines, wear a mask, practice good hand hygiene, maintain physical distancing, and download the We Health Bermuda app. And if you haven't already done so, please register to get vaccinated because vaccinations do work. Thank you.
Thank you, Minister, and thank you for the tireless work that you and the team at the Ministry of Health continue to do. Bermuda, the government understands that many are frustrated and stressed by reliving last year's restrictions, and that it may feel that the progress we made as a community is in danger of being erased. However, even in the midst of this outbreak, we have cause for optimism. We have been able to test widely, isolating positive cases and ensuring that people know their coronavirus status. For the second consecutive day, we see recoveries outpacing new cases, and our 7-day average of our reproductive number is now below 1. Our vaccination program has continued and is encouraging to see more and more people registering to be vaccinated. Our contact tracers continue working around the clock to get current with the investigation of positive cases, and early indications are that the mandate preventing the mixing of households is now slowing the spread. The reality is that our economy cannot be made to endure additional prolonged periods of economic inactivity. When work stops and stores and restaurants are closed, the impact is not just to the convenience of those of us who are customers, but to the workers in those sectors who cannot earn what they need to meet their commitments and to take care of their families. With due consideration for public health and a cautious approach that is needed to safely promote economic activity, the government has considered what can be done in this regard with effect from this upcoming week. Therefore, from 5 a.m. Tuesday, April 20th, the following adjustments to the existing stay-at-home regulations will take effect. The first thing is that a curfew will be in place between 8 p.m. and 6 a.m. every day. Permitted businesses will continue to be able to be open between the hour of 7 a.m. and 7 p.m. Retail stores, including pet stores, will be permitted to open for curbside service and delivery services. Restaurants and food service will resume for takeout and delivery only, subject to all necessary public health precautions, just like retail stores. Remote working will continue to be mandatory. However, we are working with the Chamber of Commerce and other stakeholders to provide a framework of testing employees before the return to work in those areas, such as retail and food service that will reopen. This will promote a safe working environment for workers and customers alike. The Tynes Bay drop-off facility will reopen for its usual operating hours on the alphabetical system. Supermarkets, grocery stores, and gas stations will continue to operate on the alphabetical system. Laundromats will be permitted to open, and similar to last year, they will be open by appointment with one household at a time to minimize the mixing of households. Licensed fishermen and registered commercial farmers will be permitted to sell local fish and local produce respectively at the roadside and also to engage in delivery. Outdoor construction and landscaping services will be able to resume. Courier services will be permitted to operate. Parks will reopen, but the mixing of households, as I must remind, is still unlawful. And recreational boating will be allowed, but the mixing of households will not be allowed, and this will be strictly enforced. All other restrictions at this time are unchanged. Remote working is still mandatory, and it is vital that we continue to be vigilant in order to reduce the spread. The Ministry of Health will continue to monitor our situation and recommend to the Cabinet the appropriate next steps to take. The regulations announced tonight will remain in place for at least the next 2 weeks, unless the data on the ground shows that we can move to the next phase sooner. I noted during the last press conference that the Ministry of Labor will provide information regarding the situations faced where employers may not be keeping in line with the regulations and force sick leave or vacation leave on employees during the stay-at-home order. Employers cannot force employees to take such leave, and further information can be found online, in addition to a place where you can report violations. If you want to report a violation of your employer, you can go to bermudajobboard.bm/EVTL. Once again, that is bermudajobboard.bm/EVTL, and that stands for Employment Violations Tip Line, EVTL. The government will continue to support those who cannot work due to mandatory closures and quarantine. Those persons can go to uba.gov.bm to apply for the unemployment benefit if they have not already done so. There is also ongoing support for affected businesses during the through the Bermuda Economic Development Corporation. Those who require supports can go online to bedc.bm to apply for the updated and expanded COVID-19 emergency grants, as well as updated and expanded COVID-19 combined loans and grants under the Business Continuity and Sustainability Funding Program. I'm mindful of the embodied men and women of the Royal Bermuda Regiment, the Bermuda Reserve Police, and Bermuda Police Service, who've returned to the enforcement of these restrictions. I wish to thank them for answering the call and encourage everyone in the community to respect the job they have to do as part of keeping us all safe. Needless to say, the brunt of any outbreak like this is borne by our healthcare workers and professionals. From the Ministry of Health, to the hospital, to our doctor's offices, to the molecular diagnostic laboratory, the vaccination center staff and volunteers, and many others. This is a whole country effort that fills me with pride. The incredibly hard work that is demanded of these women and men every day is the single most important shield in defense of the full impact of a pandemic that has and continues to turn the world upside down. I would also like to thank the Cabinet for their dedication and outstanding work in helping to guide our country through this difficult time. Each government minister has been steadfast in the leadership of their respective ministries and unwavering in their support of the tough but necessary decisions we have had to make together. I thank each of them for their service and am thankful to work with such a committed team. Throughout the pandemic, the ability to work remotely has allowed some sectors to continue their operations and minimize their losses in this challenging COVID-19 economy. This is not the case for our tourism sector. The lifeblood of tourism is the experience provided by exemplary service and the amenities that guests look forward to enjoying as part of Bermuda vacation. Bermuda's success in managing the coronavirus early in the pandemic built confidence in our tourism product that has seen a stronger than expected return of group business. The fragile recovery must also be protected as we navigate this outbreak, and we must continue to demonstrate that Bermuda can and will be open to tourism. We are working with Bermuda Tourism Authority and other tourism stakeholders to craft a message for the world that clearly indicates that Bermuda is working to contain this outbreak and that group business and the leisure travel sector will soon be able to enjoy Bermuda as we approach the traditional peak tourism season. The pace and penetration of the vaccination rollout in the United States, in particular, is a source of some comfort for us as we stand a great chance of attracting fully immunized guests. We will also work with hoteliers and our partner unions to continue promoting the vaccination of hotel workers to provide a fully immunized Bermuda experience for our guests. In keeping with tourism, over the past week, a lot has been said on matters regarding the St. Regis development. The development of the first luxury property in Bermuda for many years cannot be seen as anything other than a national priority. Despite what has been said, I remind everyone listening that this development is not only about providing world-class accommodation for our visitors and locals, but also about providing much-needed jobs and training opportunities for Bermudians. A few weeks ago, alongside Hotelco and St. Regis, the government announced such opportunities were already being created, including 90 jobs available in the first phase of opening. Projects such as this are good for Bermuda, and I encourage persons to support these initiatives on behalf of those Bermudians in our tourism industry who are in need of opportunities. In regards to SailGP, they have been working with the government to drastically scale back its operational requirements over the stay-at-home order period. Measures include the reduced number of people on site to only those that are essential to finishing the preparations of all 8 boats and the on-water safety trials, a reduced training program from 8 race boats to 4 boats, plus the reduction of on-site hours as much as possible. In addition, SailGP is further revising aspects of its event programming next weekend to ensure a safe and successful event. This includes changes to its hospitality program to comply with the latest government protocols and the cancellation of the ticketed tour boat spectator experiences. To ensure the safety of both local residents and its world-class teams and support staff, SailGP has worked closely with the Ministry of Health, along with other leading experts, medical professionals, and other major elite sports events on creating and implementing a robust COVID-safe plan. This includes creating protocols for all staff to operate in strict designated bubble environments, which ensures absolutely no external contact, daily health reports, and regular testing, among other measures. Last night on the local news, many would have seen interviews from members of 2 historic Black sailing clubs, East Emini Yacht Club and West End Sailboat Club. The club's leader outlined some of the incredible benefits they're experiencing as part of this event. We heard how all 8 boats involved in SailGP have adopted a local sailing club, how the clubs their youth members are benefiting from the world-class experience, knowledge, and sponsorship being shared by the participants, who are showing them that there is a career in sailing that they can take up right here from their own island. The government is committed to ensuring that Bermudians can benefit from such initiatives, and SailGP is no exception to that commitment. After this pandemic, Bermuda will need to go on, and it is important that we demonstrate to the world that we are able to host international events despite the circumstances that the country may be facing. As we begin our weekend and many convene to worship where they are, I can invite you to please spare a thought or a prayer, if that is the manner of your faith, for the people of St. Vincent and the Grenadines. In all that the world has to endure as a result of the COVID-19 pandemic, my heart is moved by the uncertainty and devastation wrought in an island by the volcanic activity this week. Even in the midst of our own struggle, at this time, I know that Bermuda has the capacity and the heart to remember the suffering of others. Next week, we will see more activity, and with the activity, there'll be need for more care in how we move about. We should still only leave home when absolutely necessary. We are not yet able to mix households, and so we must continue to safeguard those that we love. There is progress, there are small advances, and the more that we adopt proven methods of public health guidance, the sooner that we can see a full return to normal life. In light of the setback that we have endured with this outbreak of B117 in Bermuda, and the adjustment that has had to happen over the past week, the government is also taking time to map out what the future will look like for Bermuda. Next week, Sunday, I'll be giving a speech to the country to lay out where we have come from, where we are now, and where we will go in the future. Our goal is simple: to take account of the ever-changing circumstances that this virus presents to our country and our plan, and to make sure that we adjust so that this battle against the pandemic ends once and for all. I again implore anyone going through a difficult time emotionally not to suffer in silence. The Emotional Wellbeing Hotline is now open Mondays, Wednesdays, Fridays, and Saturdays from 5 p.m. to 9 p.m. If you or anyone you know requires extra emotional support, please call 543-1111. If you are in an abusive situation and need help, call the Center Against Abuse, which has a 24-hour helpline on 297-8278, where their counselors conduct sessions over the phone. If you have an emergency, dial 911. You do not need permission to leave your home if you are suffering from an abuse. That classifies as an emergency. As I close, I leave you with these words from Nelson Mandela, and I quote, "Difficulties break some, but make others. No axe is sharp enough to cut the soul of one who keeps on trying, one armed with the hope that they will rise in the end." End quote. Bermuda, we will rise in the end. We have shown our resilience time and time again, and we have not given up. We must continue to be our brother and sister's keeper, and will never allow the challenges we face to take away our hope or the hope of those around us that brighter days are on the horizon. I thank you for your time. Please stay safe, and let's continue to unite and move forward together. With that, I now look forward to questions from members of the media.
Premier, we'll start with TNN. TNN, you're live. Ask your questions, please.
Thank you much. Good evening, Travel into TNN News. Premier, let me start with the St. Regis hotel incident from the exempt situation yesterday. Premier, the situation with St. Regis indicates you and your team had been in communication with the developers. Who were the members of your team, and why did it seem that the Minister of National Security took the brunt of the responsibility?
Trevor, as you're aware, I'm the minister responsible for tourism, so it is unsurprising that a major hotel development, when we are entering a period of a stay-at-home order, would be in contact with the government of Bermuda. The situation that has been laid out is very clear in the press. We understand from the statement that the Minister of National Security put out that the permissions have been rescinded, And it is my hope, working with the developer, that we can ensure that the hotel opens on time on May 22nd, and I look forward to that happening.
See that you didn't answer my question. I was asking who was a member of your team that were in communication that got this process started from jump.
Trevor, the answer to the question I gave will not change on how many times you ask it. The fact remains is that the St. Regis Hotel is a very important development for this country. It is our first major luxury hotel that will be opening in a number of years. We look forward to working with the developers on that project. The Minister of National Security set out very clearly yesterday the views of which she has, and now we're moving forward.
My next question to you again, Premier, many people have not received the unemployment benefits. How do you comfort those persons that are struggling financially?
I'm sorry, I'm just trying to read my notes. What I know is that there are a number of persons who have received there are a number of persons who have received unemployment benefits. Those ones that were part of the previous restrictions. I just got a message today from someone who said thank you, that they were able to receive their benefits. The first application deadline will take place this Monday, April 19th, and this includes any employer verification. And for persons who go ahead and have those items submitted, they're expected to be paid before the end of next week.
Another question for you, sir. An online survey taken by Burmese has just concluded and has indicated the community's dissatisfaction in your performance as of late. What do you say to this survey?
I would say that it would not surprise me that persons would be upset when they have to be at home. The challenge that the government of Bermuda has will continue to be working. And I know the work of which I give, I know the work of which my cabinet colleagues give, and I know the work of which my caucus gives to support us inside of that effort. And so in politics, there are ups, there are downs. But what we are focused on is making sure that this country can recover, that this country can remain stable, and that this country can remain healthy. And while there are people who will be upset of the fact that they are under restrictions for us to ensure that our only hospital is not overwhelmed, we minimize the amount of death, that cannot deter us from the views of which we have, as we have to continue to press forward, because we have to make sure that we take care of the people of this country.
Now I'm going to switch to your tourism head. Any good news from the Gemcom Fremont Hotel renovations? Means there are still 800 people that are unemployed. And did the government follow through with the guarantee for their finances?
I believe that the answer has not changed from the last time I gave it, is that the Ministry of Finance continues to work with the GenCom partners in trying to advance the construction of that project and make sure we can put together sustainable financing that will work. I think that this government learns very well. I think that we know what happens when you engage in a project that is not done properly. We've seen this country having to pay for the mistakes of the former government, which happened with Morgan's Point. And so from our perspective, we're going to make sure they do it well and proper. But at least for tourism workers, there are options that will be at the St. Regis Hotel and with the work that is going to commence the Bermuda Beach Resort as well. So we're going to continue to press on in a number of cases and instances. There are additional investments which are being made in Bermuda's tourism environment that we'll be able to speak of when those things are confirmed, but we remain hopeful for the future Bermuda tourism. And the government is going to continue to work and dedicate to attract investors so that we can create more and more jobs in our tourism economy, as we think that Bermuda is a wonderful place to visit.
Thank you. My next question, Premier, to you again. You've been advocating for the people of Bermuda to get vaccinated. Can you confirm if your government MPs have been vaccinated?
I do believe that a significant majority of persons have been vaccinated, but what I'm encouraging all persons to do, and we've been consistent with the message from the government of Bermuda, and I think the Minister of Health repeated that message earlier today, is that we want people to get the facts, talk to their doctor, and make the decision for themselves. And I believe that when people do that, we will reach the point where we want to get to, which is herd immunity by the end of May. If we reach the point of herd immunity by the end of May, combined with additional restrictions to the border, we believe that we can see an end to the local impact of this pandemic. And so that's the goal. So I'm gratified by the people who are taking advantage of our vaccination program. I am proud of the people who are delivering this program. The Ministry of Health is accelerating this program to meet our targets. And there's a significant amount of work that's taking place there. But what is most important to recognize and to understand is that this is an individual decision. What I can state is that I am relatively certain that inside of my MPs will have more than the 70% of persons who will take advantage of this. So we're not going to disclose one way or the other. It is a private and personal choice for individuals, but we are encouraging persons to talk to a doctor, to go ahead, get vaccinated, to protect yourselves, and as the Minister of Health said, a key point in protecting others. We talk about the concept of herd immunity. I think it's also important to talk about the concept of herd protection, that we are protecting Bermuda from the ongoing ravages of this pandemic, of which we have seen.
My last question, people are complaining of being on lockdown while an international race is about to take place. What do you say to those persons, and what are the status? What would it look like next week this time when this race starts for the average Bermudian that might want to partake?
Well, Trevor, the average Bermudian partaking in this race was, I would say, the spectator experience, the on-ground spectator experience that was supposed to be on Cross Island was canceled a long time ago. The fact is that it is unfortunate we have a outbreak which has caused the government to implement such restrictions. But I think it's important to recognize that for Bermuda's tourism recovery, for continued growth in tourism, that we have to be able to put on international events. And there are many circumstances which may happen, but if a country cannot manage to go through the management of an international event despite circumstances, then that will mean that Bermuda will have far less ability to host international events in the future. And that is not something that anyone in tourism wants. And I don't think that's something that people in Bermuda want. I think people of Bermuda want this country to be successful in tourism, want this country to be successful in hosting events. And so, yes, things are difficult, but nothing easy ever lands on the desk of a minister or on the desk of the premier. And the government has to make difficult decisions all the time. The government took the position that in order for this race to safely take place next week, that persons will be given limited permissions to train. And that limited permissions, which I outlined, was given so that this event can take place safely next week. And given the I would say, changes that will come into place next week, persons may be in their own individual family bubbles and look at the race, I guess, from the shores, or enjoy it from their own boats, I guess. I'm not familiar with what is actually going to take place in the water. As I've indicated before, I'm not a huge fan of sailing, but what I am a huge fan of is Bermuda hosting world-class international events. And I think that it is a good thing that this event is going to be able to take place. So I'm pleased for that.
Thank you very much. We now go to Bermuda Broadcasting. Bermuda Broadcasting, you're live. Please ask your questions.
Good evening. Health Minister, given what we've heard tonight, what are your biggest concerns for the country going into the next 2 weeks?
Excuse me, I think the biggest concerns that I have for the country going to the next week is the lack of proper information and the fact that there's a lot of mischief being created on social media that's inaccurate. I would strongly encourage members of the public to get the facts and to educate themselves with respect to the importance of immunization and the vaccine. I would invite them to speak to their doctors. If I was having a conversation with someone just earlier this week and they were, had some questions, and I said, have you spoken to your doctor? And she hadn't. And she admitted that she would go and reach out to her doctor to ask the doctor requisite questions so that she could get informed and educated. And that's what my biggest concern, I think, is that there's a lot of misinformation that's out there and that it's not accurate. And I would just invite people to go to reliable sources as well, and particularly their own medical physician, to ask them the questions concerning the vaccination and the safety and so forth, because that is, as the Premier indicated, we are striving to get as many people vaccinated and certainly as close as possible as herd immunity by the 20th of May.
Okay, thank you. Just for you as well, we now have the AstraZeneca vaccine. Will people have a choice between that and the Pfizer, or will we keep giving out the Pfizer vaccine until it's exhausted?
When you asked a similar question to the CMO recently concerning that, so I'll effectively repeat what he said, which is that the AstraZeneca will be made available. There are certain individuals that, because of their own medical condition, are unable to get the Pfizer right now, but we will continue to roll out the Pfizer as well, and the AstraZeneca, as well as the AstraZeneca. Both of them are highly effective. Both of them have proven safe. You've got Dr. Miller on here who could probably add more of it from a scientific medical perspective than I, but they are both highly effective and both safe, and that both of them are available. And Bermuda is very fortunate. Unlike many other countries, unfortunately, we have had the advantage of being able to be supplied with two top-notch world-class vaccinations.
So when people go to get their shot, then they can specify which one they want?
No, they don't specify which one they want. They're rolling them out as we're using them. So the Pfizer will be used, the AstraZeneca will be used. Medical practitioners have indicated that they'll be issuing, doing immunizations as well with the AstraZeneca. Again, you've heard us speak about the cold chain challenges. So if you're going to one of the vaccination centers, they will continue to use the Pfizer, and then when that is no longer, when that supply has been exhausted, then they'll move to the AstraZeneca.
Okay. Now, I don't know if you or Dr. Miller is the best one to answer this question. How many children are currently infected with COVID?
I don't
Give an
have
update on that.
I don't have that number, but from the last data that we received, we have, I think it's 38 persons under the age of 20.
Okay, and that's the same number that was from like 3 weeks ago or 4 weeks ago?
I think it was a little bit higher than that, Don, back then.
No,
All right.
but Don, you know that we do have the dashboard on the website, so I'd invite you to review the dashboard because that has that information on the website.
Okay, thank you.
You're welcome.
Currently, and again, this might be something that Dr. Miller might answer rather than yourself, Health Minister. What are the 3 most prevalent variants of the coronavirus in Bermuda? And if we can have like an approximate percentage of each one?
Certainly, Don, I couldn't give you the percentages at all. At the present time, it would seem that the UK variant is the most prevalent, but that's as far as I can say based on the testing results from MDL. But in terms of the actual proportions, I wouldn't be able to give you that data.
Okay, and the second and third most prevalent?
And those I couldn't give you either, but you would be able to obtain that from the labs.
Dr.
If I
Miller,
may, Don,
okay, go ahead.
I think I might be able to help a little bit. I think that question was asked recently, and I think that Dr. Weldon did confirm that just about every single locally transmitted case is of the B117 variant. We don't have anything else in the country regarding locally transmitted cases. So that's it. We can get the specifics, but I think that is what she did report the last time the question was asked.
Okay, thank you very much. Dr. Miller, I asked this question on Tuesday, but wasn't able to get an answer because you weren't here. The hospital seems to be filling up. We've got 40 people in total and 8 in ICU. Can you say what percentage of total hospital beds are currently taken with COVID patients? And if there are staff shortages due to quarantines and such at the hospital, what can you do to make things cope with less staff, i.e. what are some of the services that will end up being cut?
Okay, quite a complex question you ask. In terms of the percentage of beds, I remember the last time we spoke, I said to you that I had the capacity to increase the number of beds. So at the present time, there's no shortage or any threat to shortage of beds. I have adequate numbers. Now, I did also mention that my challenge would be staffing. And that remains a challenge. However, what we have done is to cut out the day case surgery as well as the outpatient surgeries so that we have the ability to redeploy these highly skilled nurses to work in other areas. So they can work on other areas on the wards. They're able to work and man ventilators if we needed them to. So, and they were given the refresher courses as well. So we have those. In addition, the other outpatient clinics, we have cut back on them to create additional capacity. One, so that we can run more vaccines, because unless we get the vaccines, we're not going to get out of this problem. So on the one hand, we concentrate on treating patients, but on the other hand, we're ramping up the vaccine program. And in fact, we aim to do 500 per day on the weekends and some weekdays. We run from 8 to 8, even on a Sunday now.
Okay. With those people, I know there's great interest from the public on this, but those in the hospital, how many have had 1 shot of the vaccine, 2 shots, and how many are 2 shots plus 2 weeks?
And so far as we know at this point in time, or up to earlier today, there was not a single patient who had been admitted who was completely immunized. In terms of patients who may have had 1 shot, there was the odd case which may well have had the 1 shot after having contracted COVID, when you check back on the dates. But the message I would certainly give to people is that have the vaccine, because it certainly protects against serious illness. And in our case, so far, we have not seen anybody hospitalized who have been fully vaccinated and fully immunized.
Okay, thank you. And my last question for tonight, I've had a couple reports from people being told that vaccinated travelers had told them that they don't have to wear their color-coded wristbands after a day 1 negative test. Is there any truth to that, or are people trying to skirt the system?
People will probably try to bypass the system. There are regulations in place, and the regulations are there to protect them and the population. But like everything else, they will spread rumors, misinform themselves, and dance around the system if they can. There's a bit of creativity on the part of some.
All right. Thank you all very much tonight.
Thank you very much.
Thank you.
Premier, we'll now go to Earl Basden of Island Stats. Island Stats, you're live. Please ask your question.
Good evening. Good evening, everyone. Good evening, Premier. It would seem that only locals are bringing this virus to Bermuda via the planes, but because of the new variants in this virus are much stronger, why are we not issuing a quarantine order for 14 days for anyone who travels on the flights that the virus is captured on?
That's not part of our current policy right now, but as I've indicated, and I think about 2 weeks of press conferences, our future adjustments will take that into account.
Okay, all right. With the current situation of 16-year-olds and younger not required to take the vaccine, what is the plan for the Carifta Games, as this is another major international event that is scheduled to take place in Bermuda in August, and the requirement is, as it stands, is if you're not vaccinated, you're not permitted, you have to quarantine for 14 days. So what is the idea around another international event? Will concessions be made for that?
I don't have the specifics on the Carifta Games. I do know that the Minister of Youth, Culture, and Sports is working on matters surrounding Carifta, and so when those things become a little bit more clear, we'll be happy to report them, but I don't have any information on Carifta at this time.
Okay, and what is the plan to control the crowds that will most likely go on the water next Saturday and Sunday, as we have yachts at Hamilton Princess that will likely go out there, as well as local boats, as without some control, this could possibly turn into a super spreader. What is the plan for that?
Well, first thing is, I'm certain that there will not be a super spreader event. I'm relatively confident that the enforcement services will be able to enforce. We have set out the rules and laws very clearly, and there's no mixing of households, and I think that those rules will be enforced perfectly.
Okay, all right. There's a lot of speculation that once the SailGP event is over, the country will go on a shutdown. What can you say to the people of Bermuda to address this talk?
I would say that there's people who probably spend a little bit too much time engaging in conspiracy theories. And I promise you that I don't sit here at this desk while I'm here in isolation, cooking up ways to try to hoodwink and deceive people. We are here to do the work of trying to keep the country safe, trying to make sure that we hold clear to our election promises by rebuilding this economy, and we're building it with Bermudians at heart. So we go through the processes. People will go ahead and make whatever noise and suggestions. Some people do it because they actually feel that way. Other people do it because they want to make political noise or mischief. Those are people who just create accounts, put things, start things online, etc. The government of Bermuda will remain focused. The cabinet of Bermuda will remain focused. This is without question a setback. It's not a place we wanted to be, but we've demonstrated before that we can get past this. And I have no doubt that this government working together with the amazing and awesome support of all of our healthcare professionals will get past this stage.
Okay, I may have missed it, but will the parks and beaches be open as of Tuesday?
The plan is for parks to be able to be reopened, but the fact is that you are not allowed to mix households. That is what is the key point of what we are trying to stop, the transmission from house to house. We are moving in the correct direction, and we need to continue to move in the correct direction. And I will say this, Earl, if we see that there's abuse, if we see there's people that are not doing what's necessary, we do not have an issue closing beaches and parks.
And the final one, individual sports, will they be able to operate?
We haven't laid out the specifics on sports. What I would say is that if persons are mixing households, that would not be permitted. So that's what so mixing of households is not something that is allowed when you're in close contact with persons. In that measure, it's not things that are allowed, for instance, as long as you maintain social distancing. But if there's any specifics on that, we're happy to put those out. And there may be further releases from the Minister of Youth, Culture, and Sport. But on a broader level, I want people to recognize and understand we are at the first phase of this relaxation. We said a few weeks ago that we're focusing on data and not dates. We'll let the data guide us. We'll set an outline of dates so people can attempt to try to plan. But the most important way for us to get to a place of normality is, number one, for people not to mix households, number two, for persons to follow public health advice, and number three, to speak to your doctor about getting vaccinated. And if your doctor says it's something that is recommended, you should go ahead and do so.
Okay, that's my questions for the night.
Thank you, Earl.
Thank you very much. Premier, we now have Media Maya. Media Maya, you're live. Please ask your question.
Good evening, everyone. My first question is, how many people need to test positive within a work facility for the facility to either have to initiate everyone being asked to get tested for COVID-19?
Maya, part of that process with respect to when an individual case is identified involves the contact tracing element. So for example, if you have, so there's no magic number. If there is 20 people that work in a particular environment and one person has become identified as positive, and there are 3 people that are close contacts, then those 3 people will be required to test as well as quarantine. But you can appreciate it depends on the circumstances, and they always have to do an assessment because an office block of 20 could very well be spread out over 3 floors. And if the case is on floor 1, there's probably no need based on the assessment to affect the persons that are on the second 2 floors. So an assessment is done, and based on the assessment, they will ascertain how many people have to test because of their close contact.
Okay, all right. So from that, if I give an example, then if there was like 5 positive cases in a grocery store, how would that go about?
Are you speaking about the persons are employees?
Yeah, employees, workers at a grocery store, if there's 5 positive cases at one specific grocery store.
Sure. Again, it depends on the circumstances. If it's a grocery store that has only 5 employees, you can appreciate that would factor a little bit differently than, for example, a grocery store that has 100 employees. Once the risk assessment is conducted, and the case managers will ascertain what is the necessary public health measures that need to be applicable for that particular circumstance. One size doesn't fit all.
Okay, so how does this differ from when we have the schools and a couple of cases and like a whole year level, again, it would be quarantine. And then if, like I said, for example, the grocery stores themselves, let's say they all work in the same proximity, would they be like contact traced at least, or
Yes.
would that be on the manager to tell them that someone is tested positive that's near them?
Okay, there's a couple things I want to unwrap in that question. First of all, again, it's all based on the assessment. With respect to the schools, and we can use the schools as an example, it depended on the circumstances. You would have heard us speak about certain schools that may have had several persons in one particular classroom that were positive, but because of their bubbling and their circumstance that was ascertained during the assessment, that particular class might have only had to quarantine as opposed to the whole year group. But on the other hand, if when they get into the assessment and they realize it's a couple in this class, a couple in this class, a couple in this class, the assessment may reveal it's necessary for the whole year group to quarantine because of them being in close proximity. It's really difficult to speak in abstracts because it really is based on the assessment. One size does not fit all.
Okay, thank you.
You're welcome.
My next question probably goes to the Premier. The BEDC emergency grant is only for businesses that were open prior to March 2020. So my question is, what financial support can there be for new businesses that have emerged during the pandemic? What can they receive as a small business owner?
Thank you, Maya. I'm not entirely certain of the details regarding those matters which you laid out. However, I'm happy to have my staff who I know are listening to get a response and a question to you on that. I know that the Bermuda Economic Development Corporation is making sure they put things that are in place to ensure that businesses can receive support, grant funding and grant and loan funding combined as well is something that is important. We want to make sure that businesses are supported this time, and we are going to do so in the exact same way that this government supported individuals. It will continue to support individuals as we get back to work. Our goal is to get ourselves out of where we are currently with this outbreak, to reverse the trend, and to end the challenges of which the country is facing with the coronavirus pandemic once and for all.
Thank you very much. This question would be the government facility daycares for essential workers. Where are these, who are these facilities, and can you state them now, or where can the families find where these facilities are to apply?
That information was certainly put out by press release already. So I wouldn't have that information right now. I can look back at the press release, but if you look at the press release which came out from government, I think it clearly laid out how an individual can apply to be a part of that. So I think that release was actually sent last week. Friday maybe would be in there. I'm not familiar with where the locations are. I know that the Sammy Wilson Center, they may be Bellwood, I'm not entirely certain, but there is an application process that is run by the incredibly dedicated and wonderful staff inside of the Department of Youth Sports and Youth and Sport, who are doing an amazing job with this project. And I want to thank them for their tireless work. That department did a lot, and that department continues to go above and beyond, just like they did last year, where departments, when we were having issues with bus drivers who did not want to take workers, nurses to work, they got inside with the regiment and with the youth in sport and used the vans to make sure they transported workers. So they continue to go above and beyond. And like many public officers throughout this last year, we've seen examples of departments who do great work. So I just wanted to make sure they are recognized, and I thank them and appreciate them for all of what they do.
Thank you very much. My last question I will ask for tonight will have to be about taxes. I know they are due today, but was there any exemptions or really people who couldn't get their taxes done today?
Thanks, Ms. Palacio. There was a statement that was put out. I want to say that statement was put out on Tuesday out of the Ministry of Finance. The text deadline was yesterday for mandatory e-filers. That date, of course, was still yesterday. But I think for persons who file in person, that date has been extended to April 30th. But you can check your emails for the press release that came out on that, because it was sent out by the government earlier this week.
And if I could just ask the Minister of Health to repeat the email for doctors to reach who can possibly help. The email address you said earlier in the press conference, BLEF.
Thank you, Mike. BLEFKOWITZ@gov.bm.
Okay, thank you very much.
Thank you.
Thank you very much, Media Maya. Premier, we now have Jonathan Bow for the Royal Gazette. Jonathan, you're live.
Good evening, all. Can you hear me?
Yes, we can hear you.
Oh, it looks like video has come through. Jonathan Bell at the Royal Gazette. Mr. Premier, I wanted to start on St. Regis. There's a lot of issues that have come up in that one. We really want to know who okayed it. We heard from the developer that there had been a conversation with yourself. Minister Ming later said that it had been done in error. We get that, but we wanted to know who authorized it, how that process works, when the error was spotted, and does anyone get disciplined for that error? How does that work? We'd be grateful if you could address that, sir.
Happy to say so. Internal matters of discipline are handled inside the public service, and those things will never be disclosed. I think what your newspaper reported was accurate, that clearly, as I'm the minister responsible for tourism, there were certainly conversations in regards to what the impact of this stay-at-home order would mean for the on-time opening of the hotel. But what you have to understand is that there are thousands of applications for exemptions which come in, and it's not that the minister will look at every one of them. There are applications that are approved every given day that do not go to the minister, and ministers have teams, so these things can happen. The minister became aware of it, the minister followed up, and the minister rescinded it, and that's what took place.
Right. So it was yourself that okayed it, sir?
It's no, I don't okay any type of application, so I can't say that is correct.
Can you tell us who did, or I'm really just seeking to find out how the process worked.
How the process works is that applications for exemptions are considered by the team at the Ministry of National Security.
Okay, fair enough. So, I mean, there was a document that's got circulated on WhatsApp. It's got someone's name on it. I don't want to repeat that name, but it would be great to just clear it up as to who did the okay.
I'm not entirely certain what more you want me to say, Jonathan. What has been reported inside the public domain is what are the facts that are there. And you said that you don't want to call a name, so I'm not going to go down that road.
Fair enough, sir. All right, I've got you. A while ago, we heard, not wearing my glasses, hang on, yes, that you would be reviewing border controls. I guess, are you in a position where you can tell us what's in the cards? Is it the airport, plus there's cruise ships, potentially home porting here? Are you able to tell us about what you're looking at in terms of perhaps regulating our border controls?
I think for the last 2 weeks, I have spoken about what will happen in the future and the fact that we have to guard against variants and that we will be increasing our protections at the border. I spoke on a number of press conferences in a row of the need to reintroduce a period of mandatory quarantine for non-immunized travelers that will enter the country. And those will be put into place as we reach herd immunity. So I've repeated that. The specifics have not yet been finalized. We're still working with our tourism partners with the Ministry of Health to outline what the new restrictions will be so we can give plenty of advance notice for our tourism partners, but that's what's necessary. And I say it from the perspective that, you know, Bermuda and the world is in a war against variants. And so we have to prevent new variants from being introduced. We beat wild type before, we'll beat B117, but what happens if there's, you know, B1351 or P1 from Brazil or another variant, these variants emerge all the time. And so they have different effects. Some of them can evade the protections of some of them can evade the protections of the vaccines, which are there, so we don't know. So I think that it's important that as we look at the way forward, and these are the things that I'll be speaking to next week, Sunday, that we look at, and I think the people of the country want to know and want to understand what is the long-term plan and how do we stop from, you know, going back and forth as though we have thus far.
Next week, Sunday. Gotcha. Dr. Miller, or perhaps Minister, this could well be one for yourself. You've made this appeal for medical staff to pitch in to help with the vaccinations. Can you tell us where we're at in terms of numbers of medics who've done that, who've pitched in and are helping, and how many more folks do you need to give their time to get this done?
Jonathan, I think we were looking at about 40 extra to do the extra shifts that we wanted to add on for the evening shift, the 8 to midnight shift, and the weekends. And at last count, we heard from approximately 20 actually who had indicated that they'd be prepared. Oh yeah, the demand has been great. who indicated that they would be prepared to sign up to help. Obviously, the more the merrier. If we have more participants, then persons will maybe only have to work 1 or 2 extra shifts, but we're certainly happy with the demand and the uptake thus far, but we would certainly like to encourage physicians to continue to come forward to volunteer their time. That notwithstanding, we have had tremendous support from persons in the medical community, not just physicians, but pharmacists, as well as allied health professionals and others who have also been volunteering their time to do the immunization at both the hospital as well as the Bermuda College. But again, because we want to increase our output to include those hours that we spoke about last week, as well as the weekends at the Bermuda College, we do certainly want more persons to come on board to assist. Thank you.
Thanks. I'll be getting shot number 2 tomorrow. I know we want to encourage as many people as possible to get these vaccines. I wanted to check in terms of trying to find the right word for it. Potential concessions, I guess, for people who are vaccinated. Are we in a place where we can talk about fully vaccinated? They've gone the 2 weeks. Are we in a place where you can tell us what we might be contemplating in that regard? I know there are legal issues with potentially having different rules for people who are fully vaccinated and immunized as opposed to others, but I wanted to check back in on that if that's possible.
Sure. Those are discussions actually that are not just happening in Bermuda, they're happening in countries throughout the world to ascertain what benefits or incentives per se that persons can have that have actually gone and protected themselves and their community through immunization. We continue to have those discussions at the cabinet table. You would have heard the Chief Medical Officer speaking about initial concerns as it relates to 2 things. One is that the evidence still is not complete as to whether or not an individual who has been immunized can transmit the virus. We still do not know that yet. The great thing, in a perverse way, that the good thing about that is the fact that every country and all the scientists in the world are working on that and researching it. So we do anticipate that we'll be able to have some documented evidence very soon as to the level of transmissibility for that. And I'll yield to Dr. Miller, actually, because this is yielding on a medical side. However, insofar as from a policy perspective, those are conversations that we're having certainly in the Ministry of Health and certainly at the cabinet level, because we recognize that a number of individuals are saying, look, I'm immunized. What other benefits do I have? I think the main benefit that I certainly want to reemphasize before I pass on to Dr. Miller is the benefit is that you're protecting yourself and your community. So you're getting immunized for benevolent purposes for yourself and the community. Dr. Miller, I don't know if you wanted to add anything more from the scientific medical perspective that I may have not shared properly.
I agree with you, Minister, that we cannot guarantee 100% protection. But having said that, what can be considered as a benefit is that we're in a position where for staff who are fully immunized in critical areas, I can bring them back to work wearing the proper PPE, even if there was a potential exposure. On the other hand, staff who have not been immunized, the risk would have been far too great, and therefore they could not be brought back to work under the same circumstances. Now, it is a benefit to any workplace or any healthcare facility, because when we're short of staff, it certainly means that we're able to continue the service in a safe fashion with them wearing the appropriate PPE, the appropriate social distancing, not eating around others. Now, at the same time, it is a benefit to the individual because what it means is that he or she would be able to work in a situation where otherwise they may have to use it as vacation leave or sick leave or some other kind of leave, depending on whether or not they have used up all their leave for prior reasons.
Okay. Thanks for that. Thanks for that. I guess moving on, Mr. Premier, I believe I asked you, the days are all kind of blending into one. You gave a very detailed and fulsome explanation of the factors that you're looking at for getting us out of lockdown. I've been asked, is there a way, if it's possible, that you can put statistically things in more layman's terms as to what key factors you're looking at, the sort of key indicators that are going to get us out of lockdown?
Thank you. There are a few indicators that the Ministry of Health looks at, which we'll discuss. The first one is the positivity rate, and that would be the percentage of tests that return back positive. And we certainly want to get that under 1% before we consider any other further changes than the changes of which we've announced today. So that is the one that is important. The second one is our real-time reproduction number. We have a 7-day average. I think the Ministry of Health for those calculations is going to use a 14-day average, but clearly that needs to be under 1 in the first instance, where now our 7-day average is under 1, our 14-day average would not be under 1. And the real-time reproductive number is just a measure of how fast the virus is spreading in the community. If we have a reproduction number of 1, that means that each person will infect another person. And that would mean that the virus would continue going on. But if the reproductive number is over 1, such as 2, that means 1 person will infect 2 people, 2 people will infect 4 people, 4 people infect 16 people, 60 people will infect 64 people, and then you can see how quickly that will spread. So that's the reproductive number. So we want that number to be certainly under 1. And in future phases, which will be outlined as I review the matters next week, Sunday, we will map out what those data points will be, as we're focusing on dates and not data. The third item is the incidence rate. And the incidence rate is the amount of locally acquired cases inside of the community per 100,000 is the way that the World Health Organization measures that. And we certainly want to make sure that our new cases are minimized. And so those are the three particular metrics. There might be more, but all these things are going to be laid out as I discuss the measures next week with the country as our path to taking us from where we are now to a place where we don't have to get back to where we are now.
Thanks. My last one I wanted to ask.
I'm sorry, Jonathan, that was your last question.
We can give Jonathan one more.
We can?
Oh, why not?
That'd be great. I appreciate it. It's a reader who's kept asking. I haven't had a chance to get to it. So we're in a situation, okay, so there's a child, the parents are in different households, and I guess they're not clear on this. They want to know with the, I know you don't like the term lockdown, but I can't think of a different, basically the conditions we're under right now and the fact that we can't mix households, where does it leave parents who are in this situation? I guess it hasn't been cleared up for them. They really wanted me to ask. So that's my last one. How does that work?
Happy to provide an answer for you on that, Jonathan. Thank you. And just reading from the restrictions, and they're published, so you can go on gov.bm, which you can click on the official Gazette. They're also posted, but it speaks to curfew, and it says, and it gives a specific exemption for curfew. And it says, parents of a minor child who do not live together may also leave home during the curfew between the hours of 7 a.m. and 7 p.m. only to take the child to stay for 1 or more nights at the home of the other parent to give effect to an agreement between the parents. So that is allowed underneath the Act and is clearly spelled out inside the Act.
Fantastic, thanks. I really wanted that cleared up. I appreciate you.
No problem. Have a wonderful evening, Jonathan. Anyone else, Ms. Wilson?
Premier, there are no further questions from the media.
Okay, well, I mean, that ends us right at 7 p.m., which I'm sure the Bermuda Broadcasting Company would appreciate. And so I thank the members of the media for their questions on behalf of the people of Bermuda. I thank the minister for joining me this evening, and also thanks to Dr. Wesley Miller and his staff, Bermuda Hospitals Board, who continue to do incredible work in managing this. Madam Director, thank you and your communications teams for certainly all of which you do. In speaking to the people of this country, I know that we've been through a difficult period. As has been said, when things get like this, tempers get frayed. We see lots of comments, we see lots of anger. Anger will not get us past the situation which we're in. Compassion, kindness, understanding, and thought for the community as a whole is what is necessary and what is required. Your government is committed to making the decisions which are in the best interest of the country as a whole. And I am firmly of the belief that this cabinet and our entire party understands the mission at hand and recognizes what we have to do for this country. So I look forward to speaking with you and taking questions next week. And I look forward to laying out our plan for how we are going to emerge from this without going back next week, Sunday, when I speak to the country. So I wish everyone a wonderful weekend. Thank you, Bermuda, and good